Good afternoon, everyone, and thank you so much for joining us today. My name is Carrie Ann Viennes, and I am the Assistant Director of Graduate Admissions here at Bay Path University. And with me presenting today is Dr. Linda Adams Wendling. She is the Program Director for our DNP program that we will be discussing today. If you have any questions at all, please feel free to type them into the empty questions box, and we will read them at the end of the presentation. We can go ahead and get started. Bay Path at a glance. So for those of you just learning about us, we were established in 1897 and we are a private not-for-profit institution with campuses in Longmeadow and East Longmeadow, Massachusetts, and completely online, which this program is completely online. We have a student body of over 3,300 students with more than 20,000 alumni worldwide, and we are fully accredited by the New England Commission of Higher Education. There's a lot of options when it comes to graduate school, so why choose Bay Path? Well, we are flexible and accessible with our online and asynchronous learning methods, and with a supportive faculty and staff, an engaging and diverse community with an innovative approach to learning using our online learning platform Canvas. And anything that you learn in your courses is immediately applicable knowledge in the field that you're studying and working. And at this time, I will turn things over to Dr. Adams Wendling to speak about specifics on the program.
Thank you so much for the opportunity to share with you a little bit about our Doctor in Nursing Practice program here at Bay Path University. Again, my name is Dr. Linda Adams Wendling, and I serve as the Chief Nurse Administrator here at Bay Path University. And I also am the Program Director for the Doctor in Nursing Practice program. Our DNP, or Doctor in Nursing Practice program, is designed for working professionals. So the program is over an approximate 3-year period where students take part-time hours, 6 hours per semester on average, to complete the Doctor in Nursing Practice program, specifically as it relates to the BSN to DNP Family Nurse Practitioner program. The BSN to DNP Family Nurse Practitioner program is a 70 semester hour program that prepares the student to practice as a family nurse practitioner, prepares the individual to sit for certification as a family nurse practitioner. We also have an additional option for the DNP program here at Bay Path University, where individuals with a Master of Science in Nursing can join the program and complete their Doctor in Nursing Practice degree. It takes approximately 27 hours beyond the Master of Science in Nursing program to receive the Postmaster's Doctorate in Nursing Practice. We start the program in both the fall and the spring. The delivery for our program is 100% online. I do want to preface that there are 1,000 practice hours associated with the DNP degree. So those are obviously in a healthcare organization in order to complete those hours. If you enter the program with a Master of Science in Nursing program degree, we can take up to 500 practice hours from the MSN to apply to the 1,000 hours for the Doctorate in Nursing Practice. Within the BSN to DNP Family Nurse Practitioner degree, the 1,000 hours are embedded within your courses. Approximately 500 of those hours are considered indirect hours, and 500 are direct hours caring for patients. Our classes and cohorts are small routinely, so you receive lots of individualized attention from the faculty, and we have a very interactive online community. Again, to share just a little more detail for the BSN to DNP Family Nurse Practitioner program. Again, this is a 70-hour program over approximately 19 courses. Again, for a 3 to 4 year completion. Most students complete the program within 3 years. Again, we've talked about the 1,000 hours of practice supervised clinical hours. The Master of Science in Nursing to DNP post-master's program, again, is approximately 36 credit hours over 12 courses for an approximate 2-year completion. Again, within that program, you do complete 1,000 supervised clinical hours. 500 of those hours, as shared before, can transfer in from your Master of Science in Nursing program. We complete what is known as a gap analysis to identify the number of hours related to practice that you complete. Again, we've talked about the 1,000 hours of practicum. So specifically, as it relates to the BSN to Doctorate in Nursing Practice Family Nurse Practitioner program, your 1,000 hours of practicum are distributed across the discipline-specific areas of adult primary care, women's health, geriatrics, pediatrics, and mental health. You complete 150 direct hours in the adult primary care, 80 hours in women's health. Geriatrics is 150 direct hours, pediatrics 70 direct hours, mental health 50 direct hours. The balance again, which that balance with your capstone accumulates to 500 direct, and then with the indirect hours, you complete the 1,000 hours of practicum.
Great, thank you so much. I am going to take things back and discuss a bit about online learning with BayPath. The DNP program and our MSN program are completely online. This is not a response to the COVID pandemic. We have been doing online learning for a very long time, and we do it well. So we utilize Canvas, which is one of the most intuitive online learning platforms, and we offer a free course to orient new students to Canvas. So if you've never taken a single online course in your life, this will walk you through how to use Canvas, where to go, so that on the first day of courses, you're not learning new content, and also how to navigate that. That is way too much. And we want to make sure students are super confident in using Canvas way before courses even begin. Canvas is accessible from a desktop, tablet, or mobile app. It offers telecommunication and video capabilities. And we do have a dedicated online learning support team should you ever need them. Social services. So they do have an online and on-ground campus, or on-campus presence, excuse me. That is their building here in our Longmeadow campus. But we do have a ton of online programs, so they have a full presence online, over the phone, via Zoom, however you prefer to contact them. They also host a monthly webinar series called How to Pay for Graduate School. You do not need to be a BayPath student to take advantage of this. They offer this to anyone who wants to attend. They also host FAFSA Fridays, where you can get live help filing the financial aid application. And we do offer Stafford loans, which are loans that you borrow and pay back up to $20,500 per year with no income limit. So we do encourage anyone to apply for it. For admissions requirements, so we ask that anyone applying to the program has a BSN from a regionally accredited college or university. We prefer a GPA of a 3.0 on a 4.0 scale. And for the electronic application, it is completely free. There is no fee associated with it. Once you submit the application, that prompts me to get the rest of your admissions materials from you, which include all official transcripts, a statement of purpose, a current resume, 3 letters of recommendation from healthcare professionals, and the form that we ask that you use is provided online. If you have any trouble locating that, I'd be happy to send it to you, but it is right on our admissions requirements webpage on the BayPath website, and a copy of your current RN license. An online copy is fine, just as long as it shows the dates of validity in the copy. We do have 2 start dates per year, one in the spring and one in the fall. So we are rolling admissions. So the sooner I receive a completed application with everything you see here, the sooner I can issue you an admissions decision via email. This is our contact information. I encourage you to please reach out if you have any additional questions. We are always happy to meet with prospective students. This is my contact information here in admissions when it comes to the admissions process and program-specific questions. Dr. Adams-Wendling and Dr. McGinnis are happy to assist. And at this time, I will go ahead and open it up to any questions that you all have. I can see that some came through during the presentation, and that is fantastic. The first question I'm seeing come through, Dr. Adams-Wendling, is, can I complete my practice hours where I currently work?
Thank you so much, Carrie. And thank you again for the question. And the answer to the question is absolutely. We here at BayPath University in our nursing programs, we really encourage students to attain their practice hours in the work setting that they're in. Should this be helpful for them in order to facilitate completion of those hours, as well as to assist them in growing within the organization that they are already working within? So that is an outstanding question.
Great, thank you. The second one I'm seeing come through is, if I completed my MSN at a different university, do I have a potential for transfer of credit toward the DNP?
Absolutely. That is something that we have really worked hard on with our Master of Science in Nursing program, so that, as well as transfer into our Doctorate in Nursing Practice program. What occurs is that I will look at your transcript and ensure that your MSN courses meet the requirements of the MSN level courses within the Doctorate of Nursing Practice degree. And so routinely, individuals with a Master of Science in Nursing program will be able to complete the Doctorate in Nursing Practice within 36 credit hours. Many individuals will complete the Doctorate in Nursing Practice degree within 27 hours, with a maximum up to 45 hours, depending upon the number of practice hours that you have attained within your Master of Science in Nursing program. So again, the direct answer to the question is absolutely, and we will ensure that you get as much credit as possible for your Master of Science in Nursing program.
Thank you. The last question I'm seeing come through is, are there any concentrations associated with the DNP?
Yes, with our DNP program, as we have shared earlier, We have two options right now. The first option is the Bachelor's of Science in Nursing program to the Doctor in Nursing Practice Family Nurse Practitioner program, where you are prepared as a nurse practitioner. And just a little additional information on nurse practitioners. We all know that there is a national nursing shortage, but there is also a national nursing shortage specific to practitioners. Um, the Bureau of Labor Statistics through 2030 is predicting that on an annual basis, there could be as much as a growth of over 50% in the growth of need for nurse practitioners. And the family nurse practitioner in primary care has a huge demand for the future. Additionally, nurse practitioners, their average salary across the United States averages approximately $120,000 per year. So it's a very good career from a standpoint of establishing a good income. The second track that we have is the Doctor in Nursing Practice Postmasters program. And the Doctorate of Nursing Practice Postmasters program, as shared earlier, you can complete that degree again in approximately 36 hours, with many individuals completing in 27 hours. The Doctorate in Nursing Practice degree overall is a 70-hour program, but you can attain many of those hours again with your Master of Science in Nursing program transferring in. Individuals who are already advanced practice registered nurses, meaning they are licensed by their Board of Nursing as advanced practice registered nurses, come into the program and routinely will meet all of those 500 master's practice hours. So we'll complete approximately 500 hours within the postmaster's DNP. Individuals who do not have a license as an advanced practice registered nurse, but they have a Master of Science in Nursing with another focus, will complete the degree. Again, we will evaluate the number of practice hours. They will complete the necessary practice hours in association with that master's, and then complete the final 500 hours towards the 1,000 hours of practice hours for the Doctorate in Nursing Practice. I know it can start sounding kind of complicated, but the process is very smooth, and we will ensure that you get and receive as much credit as possible. The Postmaster's Doctor in Nursing Practice at Bay Path University focuses on forwarding the individual's career from a standpoint of aggregate systems and leadership focuses to take the Master in Science in Nursing prepared nurse to the doctor level or the highest level of nursing practice, whereas the BSN to DNP Family Nurse Practitioner program takes the baccalaureate prepared registered nurse to that highest level also of nursing practice as a doctor prepared nurse practitioner. So hopefully that helps to clarify the options here at Bay Path University.
Absolutely. Thank you very much, Dr. Adams-Wendling. That concludes our presentation for today, but thank you so much for joining us. And as I've said before, if you think of anything else, please feel free to reach out to Dr. Adams and myself.
Thank you so much for the opportunity to visit with you. Bye now.